Hello and welcome. This is Dr. Jerry Cuomo. I'm here in my Boca Raton office, and we have a rescue case today brought in by an outside office, and it's number 30. Out, please. Specifically, it's an internal hex biohorizon. The referring dentist had a chance to rescue. He got a kit, used the kit, and fell a little bit short. So we were able to uncover the screw and abutment all with a diode laser. Once we did that, I was able to see exactly what's going on internally. And so by the grace of God, we were able to remove the abutment, manually remove it. So first attempt. This is the remnants of the abutment. It is an hex. You can see where the operator just deviated slightly but stopped, which was good. And I believe it is slightly abraded internally, but not to a point where it's going to stop any kind of maximum function of the new implant. This is a titanium base abutment. So there's a difference between the titanium base abutments, or they're called tie-base abutments, and that of the custom-made abutments. So we're going to talk about that too. I've seen a lot of these type of abutments. They work well under bridges, but here we are. It's by itself. So a tie base may not be the complete answer. So we'll talk about more custom-made abutments toward the end of the video. So right now I'm going to use a suction device. We borrow things from the root canal specialist. Now all miniature scale. This one's in small suction. It's color-coded yellow for its diameter. We're going to go in, and you'll see actually now the easy access now to this to the last component that has to come out, which is the broken screw, abutment screw, that is. So there it is. White, please. And then you can see internally light air syringe on the mirror. I'll try to keep that in focus. So it's did not abrade. You can see where the screw head tore, but there's no abrasion to the first thread, so that's good news, nor to the hex. Okay, so, but we know it's important to go in and pre-soak these things first. Even though there's mobility, you want to pre-soak it. All right, so we'll do that next. We're going to use a mix of, we love this mix. It works great. It's a mixture of tartar and stain remover and a little bit of machine oil. It's for hand pieces, machine oil. We sometimes, I'm amusing my patient here. We sometimes use Crisco when we're drilling. Crisco, it has a real thick consistency, so Crisco oil, but it's more of the part that's used for doing, big cooking out there, cookies, things like that. So I'll show you what that looks like. And that's the Crisco. You see it's white, looks like coconut. Works great though. All the filings go right in it. We're using tartar and stain. It's a light acid, very, very light acid with the oil. Works great. Cuts through the tartar if there's any buildup or any bioburden in there. You take a look at it over time, you'll see it goes from clear to a cloudy consistency, and that's what we have right now. So it's penetrating it. Also, you'll see some bubbles. Sometimes it'll give off some oxygen from the bacteria. You want the threads to kind of be ready for us and loosen up that bioburden in there so that the rest is easy. Once it's in for a period of time, we can also soak a little bit of peroxide in there. Sometimes that helps the bubbling action. We have a healing abutment ready to go in that is located right over here. And yeah, here it is. So you can see the size of it. It's quite a large canister. I'm gonna pop it out. Out of the sterile pot. You see it's color-coded blue. That matches the inside of the fixture. Blue and blue. Alright, so there's no mistake. The other thing is we need a good driver. So what kind of driver are we looking at? It's going to be a hex driver. It's going to be a driver that we would have to pre-fit first to that healing abutment. We will hand tighten that in place. Back with the suction. There we go. And just continue to go in a counterclockwise rotation. You start to see the screw head pop up a little bit more. And then go closer to see. We can almost get that out with just a suction tip, but it doesn't want to come straight out for us. There we go. Now it's moving. You can see there's no abrasion at all. Alright. Let's go ahead and soak it again. We can turn it, keep turning it. And we'll suction it out again. We'll give a shout out to our lab up there in Boston. That's Danny Karam and Advanced Dental Technologies. You can find them. They do a lot of work for the local dental schools up there. Custom abutments definitely come in real handy for supporting, I would say, the entire foundation, because that's what they are. They're not pulled out of a drawer. You can actually have the lab, will look into, this case is BioHorizons, so you can have the lab look into that. They have their own departments. They can work directly with BioHorizons, and there's also Atlantis from Dent Supply. They work really well with cases. I'm going to use a prong instrument that I custom made for situations like this. And if you look at the tips here, we have 4 little prongs. The only issue now is trying to make sure that if we can get in there straight up and down. It looks like we got plenty of room, so my wish is that the diameter fits well, and when I turn it, the screw head starts to come out, or the top of the screw, and yes, it is. So that's the unthreaded shaft that you see, and you'll start to see the threads come up next. So we got a whole of the unthreaded shaft, and the turns I'm making on that are quarter turns. So there it is. You can see how that one's kind of whittled around the sides of it, so it probably was sticking way up pretty high And so when the operator was going after it, he might have been going around its sides, and that's my hunch. We won't know until it comes out. Obviously, we're going to keep all the parts for BioHorizons because that's where they're going to send this back to. And now we're going to have a special suction. Now it's going to have a pink screen on it. And once I get it to the point where my dental assistant can just go right on top of that and then pluck it out. We're at that point, so she's going to go right on top and out. Not quite yet. Okay, 1/4 turn more. Let's just see. Let's go one more time. And zoom in on that. There it is. Okay, now she can grab it. All right. So she's going to bring that back. There's the threaded portion, unaltered. Perfect recovery here. So I'm going to just grab a cotton plier and I'll show you what this screw looks like. And then we'll take plenty of photos. Again, a custom abutment versus the tie base abutment. Very important to know the difference and what they're capable. This is the screw. So if we count the threads, it's only 5 threads to it. Okay, so it's a very specific screw. Has a very long shaft to it. With just 5. Other companies, some of them have 9 threads. The most important part is this shaft of the screw itself, and that has to be further investigated. As to it looks very tapered here, and then you can see the area where it's torn. So that might have been part of the technique from the referring dentist. That goes in a cleaner. We're back in here cleaning up the threads, and we'll put in this this healing abutment. So I'm going to pre-dip TNS and a little bit of oil. Go drop it all the way in there. Now I have total access of the threads now. And we're going to end up with a pristine environment, ready to go for the treatment again. All right, and we'll suction that. Actually, I'm gonna rinse that first, and then we'll suction it up. Okay, perfect. And there's the inside. You can see a little light abrasion there from the operator, but nothing, no side effects here on that. Okay. All right. Let's try in our abutment. I'm going to just go in with my hand. There we go. We'll get it started. There we go. And now I'm going to get a driver and I'm going to actually tighten that into place. But there you have it. All right. And again, Danny Karam up there at Advanced Dental Technologies and up in the Boston area, up in the Massachusetts area. Look him up. Talk to him about the nice custom abutments that they're making up there for doing precision work with implants. Dr. Gerry Cuomo, thank you for watching. Hope this helps anyone out there who needs help. Just feel free to give me a call here at the office and subscribe to my channel. Take care.